Good afternoon, everyone. Thank you for joining today's HHS briefing on the new Provider Toolkit for Sickle Cell Disease. My name is Zainab, and I work in the Office of Intergovernmental and External Affairs here at the U.S. Department of Health and Human Services. A few housekeeping items before we begin. This briefing is open to the public. However, any press in the room, if you have any questions, please direct them to our press office, media@HHS.gov. If you have any questions during today's briefing, please use the Q&A function at the bottom of your screen. You can submit your questions at any time, and we'll do our best to address them, or we'll follow up with everyone after the briefing. Again, if you have any questions, you can use the Q&A function or email us at scd@hhs.gov. That's scd@hhs.gov. Today's briefing, you'll hear from leaders here at the department and the federal government who are driving the critical work around sickle cell disease. This includes, obviously, our Centers for Medicare and Medicaid Services, also known as CMS, who has been working tirelessly to put together the new Provider Toolkit. As well as our colleagues at the Social Security Administration, SSA, who has new resources to support patients living with sickle cell disease. First, I would like to introduce someone who has been a close advisor to the Secretary, Executive Sarah, and has been advocating in making sure that sickle cell disease remains a top priority here in the department. Please join me in welcoming Lynn Shaw, Counselor to Secretary Becerra, who will provide a brief overview of the department and the Secretary's priorities. Lynn?
Thank you so much, Zainab. It's great to be with you all. Happy Wednesday afternoon. Congratulations for getting this far in the week, and thank you so much for sharing part of your Wednesday with us. As Zainab mentioned, my name is Lynn Shaw. I'm a counselor in Secretary Becerra's office. I work on a variety of issues, but one of the most gratifying issues and meaningful issues that I get to work on, among the others, is sickle cell disease. Over the last year and a few months or so, give or take, I've had the great privilege of getting to work with the folks you see on the screen, David Wong, who, as many of you know personally, but also know that he leads the sickle cell disease work at HHS, Didi Malik, Dr. Malik, who has served many roles, but is very much one of our key partners in advancing care for sickle cell disease in CMS, across HHS, and in the administration. And I'm so excited to have Michael Goldstein and Andrea Bento from SSA with us today. It doesn't always seem like it, but our buildings do talk. And I think David, Michael, and Andrea have probably talked more than most of us about the great work that SSA is doing to try and make sure that we give sickle cell disease and individuals with sickle cell disease the appropriate and the most attention that we can. And I also just want to give a shout out to Zainab, because she has really gone above and beyond and doing so much work. As some of you who are with us today might have been with us at the Sickle Cell Disease Summit, and I have to say, without David and without Zainab, there would have been no Sickle Cell Disease Summit. And so I just am so grateful to my colleagues. I don't want to take up too much more time. I just want to say that the work on sickle cell disease and sickle cell trait, it continues at HHS, whether it's super visible to the public or not. I want to make sure that the folks listening today know that no matter what happens from administration to administration, sickle cell disease and sickle cell trait is a top priority within HHS. This toolkit that has been released now for just under a month, Dr. Malik has been leading that work at CMS with a number of our colleagues. That is something that CMS has done out of a labor of love. As some people may be aware, the demands on everyone within HHS are enormous, day in and day out. People work what feels like 24/7 often, and it never feels like we have enough time to do all the things that we need to, but we make sickle cell disease a priority. And we do that because the sickle cell disease population deserves that, and they have long deserved that, and it's long overdue. And because Secretary Becerra cares deeply for this population, and he has made it a priority from day one. And so I just want to thank you all for your patience, your willingness to educate us, your wisdom, and your kindness. And we will miss you all very much, or I'm speaking for myself selfishly, because I'm not sure how many more times I will get to speak with you all. But I greatly appreciate you all being our teachers and bearing with us as we do our best to give you as much care as we can. Zainab, I think I give it to Dr. Malik now, or David.
Dr. Malik.
Okay, Aditi.
Thank you, Lynn. And I will add my voice to the chorus of thank yous to all of you for joining us today. And as Lynn so eloquently shared, for being our partners, not just today, but in the days and weeks and months that got us to today. I will take a few minutes of time to share a bit about the toolkit. Before I do that, I really want to say thank you for your input. I can't quite tell exactly who's on this call, but I am certain that folks on this call provided us with constructive feedback that we needed to hear, that really helped inform the development of this toolkit. It helped inform the CMS Sickle Cell Disease Action Plan that we released last September, and it helped inform this toolkit that, as Lynn said, we released a few weeks ago. And I sincerely hope that as you have a chance to look through it, you can see and feel some of your feedback reflected in there. I'll invite you now to scan the QR code or go to your search browser of choice to follow along in the toolkit if you so choose. But this toolkit, just to give you a sense of why did we do this, so we kept hearing time and time again that it would be helpful to have a one-stop shop of sorts where clinical providers or individuals with sickle cell disease, their community, their caregivers, their families could go to understand, well, what are the resources that CMS has across the full spectrum of coding and payment, et cetera. And that's really what this is designed to do. It's designed to help support infrastructure in primary care and other care settings, to help with care management, and to help assist clinical providers and people living with sickle cell disease in managing and seeing and appropriately managing the needs of people with sickle cell disease and other chronic conditions. And I'll touch on some of those specifics as we go. But as I said, I invite you to follow along on your end. And I want to share in a bit more detail and illustrate how we collectively think and hope that it may be useful to you all. The toolkit, as you see, for those that can see what we're screen sharing here, the yellow box on the right-hand side of your slide, the toolkit consists of 6 sections that really are designed to equip care teams in delivering high-quality care. And it's designed to introduce sickle cell disease, but also includes common barriers to care that, again, we've heard from so many of you, and summarizes CMS programmatic coverage for services around physical health, mental health, social determinants and drivers of health, as well as some of the novel sickle cell disease treatments. The first section is on screening and diagnosis and provides a brief overview of how sickle cell disease is diagnosed. It's really just to level set for folks. There's a much more detailed appendix that has the full background on the pathophysiology of what is sickle cell disease, what is sickle cell trait, but really wanted to hone in on actionable insights. Section 2 on treatment includes information about established treatments like hydroxyurea, as well as novel therapies like gene therapy. The third section, which is called Comprehensive Care for People with Sickle Cell Disease, has information and sections on culturally tailored care, the transitions from pediatric to adult care, which we've heard from many of you as a particular pain point, pain management, which we've heard from many of you as a particular challenge, and the stigma associated with getting appropriate pain care, telehealth and the importance of those flexibilities, not just during the pandemic, but moving forward, and social drivers or social determinants of health, which I'll talk more about in a moment. Section 4, called CMS Programs and Resources that Support Comprehensive Sickle Cell Disease Care, has detailed information about payment and coverage for medical treatments, payment and coverage for pain management, and payment and coverage for gene therapies. Each of those sections is intentionally separated into Medicaid and CHIP and Medicare, recognizing that those as insurance programs are distinct and have different authorities. It also has information on services and care coordination and social drivers of health, including separate sections on transportation, nutrition, and housing, which we've heard from many of you are really important. The fifth section, called Supporting Multidisciplinary Care Across Settings, is geared towards different care settings. So there's information about primary care settings, urgent and emergency care settings, behavioral health settings, and then a section that underscores multidisciplinary teams. We also make particular mention, or the toolkit, I should say, makes particular mention of community health workers, patient navigators, and peer support specialists. And last but not least, there's a section called Resources for Individuals with Sickle Cell Disease and Those Who Support Them. And that is a series of links and resources to peruse or utilize at your leisure. And sprinkled throughout the toolkit are links to other either CMS programs or from our partners across HHS that are focused on sickle cell disease and or can be brought to bear in the care and quality of care for individuals with sickle cell disease. So I'll just close by saying, as Lynn said, a real labor of love. And we really, I will say on behalf of my colleagues, hope that it's a useful resource to you. And my deep and sincere thank you for your partnership on this journey together. With that, I am delighted to pass the mic to my colleague, Andrea, from the Social Security Administration. Andrea, over to you.
Hi, good afternoon, and thank you, Dr. Malik, and thank you to everyone at HHS who included us in this webinar and also have been kind of working with us over the last several months. We have at SSA, we've also been, trying to prioritize making sure that we provide equitable and compassionate, responsive service to individuals with sickle cell disease who apply for disability benefits. We know that is one piece of the puzzle, and we've also been trying to kind of get out of our silo in SSA and reach out and Dr. Wong and many of the other people on this call and that you've heard from have been really instrumental in helping us do that. So we've been meeting regularly, getting feedback from not only our partners in HHS, but also the advocate community, community-based organizations, actual warriors, individuals with sickle cell disease and their families, and medical providers. So we've been working really hard to engage kind of all the stakeholders and make sure that our program is as responsive to the needs and kind of also working, with the rest of the federal government, since we all are all under one big roof. And so we really appreciate the partnership there. I did want to introduce my colleague, Michael Goldstein, is also online. He is the Director of Medical Policy at SSA, and I am a technical expert within that office. So we just wanted to share with you a little bit about what we've been doing. We are looking at kind of long-term and short-term approaches to making sure that our program is responsive and is up to date, because we know as we saw with that, that great toolkit, there's so much that's changing and so many new resources available to healthcare providers as well. So a lot is changing and we want to make sure we're keeping up. So one of the things that we're doing is we've contracted with the National Academies of Sciences, Engineering, and Medicine, we just call them the academies, to convene a consensus committee that will consider and that will provide us information about advances in medical treatment, different issues with access to care, different treatments and sickle cell disease complications and management. And we're really excited to hear from them. That can help us to kind of hone in our medical criteria that we use as part of our disability evaluation. So we are looking forward to a report from them. Our kind of final report should be available around November of 2025, but we will also get an interim report before that. So we're really looking forward to kind of keeping the momentum going here and just making sure that our program is staying up to date and is, not falling behind the rest of medicine. So we appreciate all of you and any information you also want to provide. We also wanted to share with you the resources that we've published in the last, probably around the same time you all did a few weeks ago. I think the final ones were ready. So we're all kind of on the same page and on the same timelines here. Another shout out to Dr. Wong. He's been very helpful as we've been kind of preparing these resources for publication and also, again, connecting us to advocates and individuals with sickle cell disease so we can get more information. We've held listening sessions and kind of been able to get that information about, what people need to know about disability, where are the pain points with the disability application process, and how we can help. So one of the big things that came out of that was kind of just the feeling that sometimes you can apply for disability and just not really know what's happening with your application. You might get denied for disability and not know why. You may apply 3 or 4 times and then finally get it, and you don't know what changed when you finally got it. So part of what we're trying to do is kind of demystify the disability evaluation process and the application process, and provide also just kind of resources and reminders and tips. So that's what the 2 of the guides on the screen are kind of designed to do that for adults and for children, because we have different rules in evaluating disability for adults and for children. So we have and I can hold them up, the flashy versions, the guide Sickle Cell Disease and Social Security Disability Evaluation Process for Adults. And then we also have one, essentially the same title, but for children. And in that these guides, we provide kind of visuals of the disability evaluation process and additional information on what we need from the applicant to fully evaluate their claim for disability. So we're really excited about these guides. We think that they will really help to empower the warrior community and individuals with sickle cell disease who are applying for disability benefits. We also have a new guide for health professionals, and this provides information for providing medical evidence to support a Social Security disability claim. So we think this will be very helpful for providers who have patients with sickle cell disease who are applying for disability, and sometimes you don't know. Sometimes we hear from providers, they're kind of in the same boat. They don't know why their patient was denied or why their other patient was, allowed disability. So it provides kind of the background information for medical providers as well, a little bit about how our process evaluation works, and also what kinds of medical evidence we can receive that are really helpful for us in evaluating the claim. And so we have on the screen the general link that you can use to access all of these resources is fairly simple. It's www.ssa.gov/pubs, so PUBS. On that web page, there's a search bar on the top. If you just type in sickle cell, all 3 of these will come up, or sickle cell disease. But we also provided the direct links to each of those on the screen and also in the chat. So we're very excited about these resources. We do think that they will help individuals with sickle cell disease and medical providers to be able to kind of feel empowered and work with us as we go through the disability process. We know that oftentimes applying for disability, not only the application process, but also kind of dealing with the health issues that got you to that point is a very difficult time in people's lives. So anything that we can do to make it better, we are happy to do it and excited for it. So we just wanted to thank you all for the time, and we appreciate you all, and please share those links as widely as you can. And if you want to print out some of these and leave them in your office for people who are trying to apply, we really want to kind of not hide the ball. We want to demystify that disability application process. So thank you. And without further ado, I will hand it back to Zainab for closing remarks.
Thank you, Andrea. Thank you, Dr. Malik and Lynn, who have been tirelessly working on sickle cell disease across the agency, but across the government. So thank you for your time. And with that, we're now at time. As you may have noticed, today's briefing was recorded. We'll be posting the recording on HHS's YouTube channel sometime this week or early next week, and we'll make sure to send the link to that hopefully next week once the recording goes live, along with all the resources that was shared today. So all the links to the toolkit and the SSA's resources will be shared in a follow-up email hopefully next week. Again, thank you all for joining, and thank you for submitting questions. If you have any question, please email us at scd@hhs.gov. That's scd@hhs.gov. And we'll answer all of your questions there. So thank you, and I hope you guys have a great rest of your week.
Produced by the U.S. Department of Health and Human Services.